joining us today for our latest Boys, Men and HPV webinar, brought to you by Global Action on Men's Health and No Man is an Island Race to End HPV. And today we're delighted to bring you a session as titled on the screen in front of you, Reframing HPV Prevention, the Role of Male Vaccination in Advancing Female Vaccine Uptake. If I can get the next slide, please. A little bit of housekeeping quite quickly before we get on. So many of you doing so already. Brilliant. Please do let us know in the chat your name, your organization, where in the world you might be joining us from. A little bit of housekeeping in terms of comments and the Q&A. So use the Q&A function to ask questions and the chat to make comments. We will have time at the end for a Q&A with the panel. Hopefully a very thought-provoking and stimulating afternoon ahead of us. So please do take part and be active as part of it. If, however, you just want to absorb, take in the sessions, good news, it is being recorded as well, and it will be posted on the GMEH website and the YouTube channel, and the session will last around 60 minutes. Next slide, please. So why today's webinar? Well, as we say here, despite increasing attention to HPV prevention, the impact on vaccinating males against HPV on female vaccination rates, we believe is insufficiently recognised. And ladies and gentlemen, I am a simple man, and I believe that quite simply, routine universal HPV vaccination programs simplify public health messaging. We're talking about protecting everyone against the virus that affects everyone, quite simply. And more seriously, routine universal vaccination programs are more resilient, they're less stigmatizing than female-only programs, and they are more ethical and equitable in terms of protecting everyone against all HPV diseases and cancers. So today, we're thrilled to bring you a wonderful panel of speakers who will bring examples from Tanzania, Cameroon, France, and more broadly around healthcare workers to talk about this issue of vaccinating boys and its associated effects on increasing vaccination uptake among girls. So with that, go to our next slide, please. For those who don't know me, hello, I'm David Winterfield. I'm the director of No Man is an Island Race to End HPV. And it's my great pleasure to introduce you Dr. Sue Kelly from London School of Hygiene and Tropical Medicine and Mwanza Intervention Trials Unit. She'll be our first speaker today. Joining her will be Dr. Andreas Njo, Deputy Permanent Secretary from the EPI and the Ministry of Public Health in Cameroon. Thanks so much, Andreas. In addition, Dr. Ricardo Berdier from HPV Prevention and Control Board in Antwerp. Dr. Sandra Chiridiotis from the Public Health Agency of Canada. Thank you for your early start, Sandra. And bringing us home will be my dear colleague, Dr. Tim Shand from Global Action on Men's Health. Some quick acknowledgements before we begin. Global Action on Men's Health's work on men, cancer and HPV is supported by a grant from MSD and by No Man is an Island Race to End HPV. You've heard enough from me. So it's my great pleasure now to introduce Dr. Sue Kelly, who will be our first presenter today. Sue, over to you.
Thank you, David. I'm going to share my slides. She said confidently.
We've all been there. It's a Monday as well, so we'll be kind.
Okay, thank you. Can you see? Can you see the slides?
I think they're just loading up now. Yeah, so if you could make that full screen.
Okay. Sorry.
No problem.
It's not.
So if you hit slideshow at in the top bar.
Wait a second. Okay, there we go. Thanks. Great. So I'm very happy to be here. My name is Dr. Sue Kelly, as David mentioned, and I'm going to be presenting today on social sciences in the ADVAC trial, which is an ongoing clinical trial in a cluster randomized trial in Northwest Tanzania, Mwanza region, and I'm going to present on acceptability of the male HPV vaccination among adolescents and community gatekeepers. So just as a bit of background, HPV vaccination was introduced in Tanzania in 2018 as the cervical cancer vaccine through a multi-dose regimen using four-valent vaccine Gardasil, introducing or into 14-year-old girls was where the program started. In April 2024, Tanzania introduced single-dose HPV vaccination through a multi-age cohort campaign offering the vaccine to 9 to 14-year-old girls, and 9-year-old girls are receiving the vaccine now in Tanzania. So this work is part of the ADVAC cluster randomized trial, which has the aim of measuring the impact of one-time single-dose HPV vaccination of young men on community HPV vaccination prevalence across 26 Northwest Tanzanian communities. The trial is ongoing, and we are just now in the final phase of the prevalence survey of that trial. So this work is particularly important because this is the first time that HPV vaccination has been offered to adolescent males in Tanzania. So let's see, sorry about that. Slides are going. So the work, the aim of the study, the social sciences study, was to explore HPV knowledge and acceptability of the single-dose male HPV vaccination alongside the Tanzania National Program, which was offering the vaccination to girls. We used a variety of qualitative research methods and collected data between July 2023 and May 2024. We spoke to a number of stakeholder groups, including parents, health workers, community leaders, teachers, and we also spoke with young people. So in school and out of school young men who accepted and declined the HPV vaccination offered through the trial, as well as conducted focus group with in-school boys and girls. Topics that we discussed with study participants included their knowledge of HPV, cervical cancer, and HPV vaccination, attitudes and acceptability of the HPV vaccination for both boys and girls, and rumors associated with the trial and HPV vaccination in general. We had a few extra questions for boys and girls. So for the boys, we asked them how they made their decision to vaccinate. And then we also asked about their views on accepting or receiving a vaccination that helped themselves, but also supported safety of the unvaccinated sexual partners. So girls, we asked them about how boys' HPV vaccination influenced their decisions to receive the vaccination. Overall, most participants across all participants groups recognize HPV as a sexually transmitted infection. Most people who were not health professionals didn't make the connection between HPV and cervical cancer. However, this quote from a secondary school teacher, he indicated that he had heard of cervical cancer, but he did not know of HPV, and he did not know that males could be infected with HPV. And he said that he didn't realize that men could pass it on to women. Looking at barriers to acceptability, we saw that rumors, speed of the vaccination exercise itself, and the need for more information came out as barriers. Rumors such as concerns about infertility, as well as COVID-19 vaccination. The vaccination period was very close to the end of the COVID-19, the height of the end of the COVID-19 pandemic. And so people were a little bit hesitant about whether it was really HPV vaccine that was given. However, rapid community engagement addressing rumors resulted in more than 67% of the target population accepting vaccination. So speed of the vaccination exercise, young men who said they would have vaccinated that were either absent in the area at that time or were not well on that day, when they went back to find the vaccinators, said that the team had moved. So the speed of the vaccination as it was being offered through a trial led to some of the barriers to uptake of vaccination, as well as all participant groups asked about receiving more education and information. The quote from the nurse indicated that it's really vital that community leaders be provided with HPV vaccination information because they are the people that community members ask questions to. So facilitators, we saw that gender equity came out very clearly across participant groups. People said that boys should be offered the same opportunity for protection against HPV infection and the resulting diseases that it can lead to. Boys suggested that they were happy to be vaccinated, and that they were also keen that their vaccination would support the safety of unvaccinated girls, and that we also found that the vaccination of boys was an influence on girls' uptake. So it was several focus groups, but in those focus groups, it was indicated that boys' vaccination, girls were interested to learn more about all the different conditions associated with HPV infection, and that one girl said that her father had initially declined her vaccination, but after learning about all the conditions, he told her she needed to go and get the HPV vaccination. So overarching themes were message, messenger, and time. And so regarding messaging, we saw that HPV-related conditions beyond cervical cancer motivated both parents and adolescents to support vaccinating both boys and girls. Framing HPV vaccination as a gender equity issue and highlighting the economic burden of illness emerged as important themes. And this came out, we didn't even initially look for the economic burdens, but people continually talked about how the cost of illness within the families and the cost to the nation. Participants regarding messengers, they wanted to see trusted, locally recognized messengers, and that parents and peers were key influencers of adolescents, while health workers and community leaders influenced parents. And with regard to time, people indicated that they needed time to make the decision about vaccinating boys, and that some said that once seeing boys didn't have adverse effects from the vaccination, they would take up the vaccination. So overall, on conclusions, single-dose HPV vaccination of males was generally acceptable across all participant groups in the rural Northwest Tanzania communities where the study was conducted, framing HPV vaccination as a gender equity issue, and discussing the full spectrum of HPV conditions beyond cervical cancer did influence acceptability of uptake of the vaccine for both boys and girls, and that it was essential that ongoing and dynamic community engagement that discussed concerns in communities and rumors that were raised is essential to introducing a new vaccination into a new a vaccination into a new population. So this is the article that, if you want more information, was published in Vaccine. So the findings from the study in Vaccine in January 2026. And just like to thank and acknowledge the study communities that we conducted our research in, as well as the ADVAC trial leadership and co-authors and the supporters of the study. So thanks very much.
Thank you, Sue. And reminder, ladies and gentlemen, please do submit your questions for Sue for the Q&A, which we will have at the end. It's now my pleasure to introduce Dr. Andreas Njo from Cameroon. Andreas, over to you for your presentation.
Thank you so much, David, for giving me the floor. And I'm honored to make the next presentation, which is still on the role of male HPV vaccination in advancing female vaccine uptake. And we're going to look at the case of Cameroon, the gender-neutral immunization program we have in Cameroon. So I am Andreas Njo, and I'm a medical doctor working with Cameroon's Ministry of Health. So we will adopt this outline. And just to remind us that though cancer, like cervical cancer, is preventable, and other cancers affecting men favored by HPV are preventable, they still remain a major problem worldwide, and especially in Cameroon, where we have some of these cancers like cervical cancer, the second killer in Cameroon for cancer cases. And in 2024, we had nearly 2,000 cancer deaths in Cameroon linked to a preventable disease. And unfortunately, the screening services for cervical cancer remains very low in Cameroon, and less than 5% of women have ever been screened for cervical cancer, a situation that is fully preventable by immunization. With this in mind, the country has gone through various stages in its vaccine program to eliminate HPV that favors cancers in men and in women. So between 2010 and 2012, through the Cameroon Baptist Convention, HPV vaccination began in two of the country's region. And later on, with the lessons learned, Gavi funded the program to pilot HPV vaccination in two of Cameroon's region, which was a great success with coverages over 70%. And with all of these good lessons, the country decided to engage in nationwide HPV vaccination with 2 doses just to girls through the expanded program on immunization in the Ministry of Health. This came up in the context of great hesitancy, as we'll see next. And by 2023, the lessons learned prompted the Ministry of Health to move on to vaccinating boys alongside girls. So from 2022, when the country introduced HPV vaccination, the program was faced with great challenges. Why just girls? And this also came in a context of targeting a group that wasn't the usual target of the immunization program, and also amidst COVID-19 vaccine hesitancy. So major opposition came from local authorities and religious leaders on why the government decides to vaccinate only girls. And the Catholic actually banned HPV vaccination in their schools and health center. That contributed to nearly 30% of service delivery of the immunization service. And further, they call on the head of state action to suspend vaccination against HPV of the girl population. Local authority also encouraged the population not to get vaccinated. And this was even worsened when health officials and the Cameroon Medical Council passed on contradictory messages. 3 years later, the first dose vaccination coverage remained at less than 20%, and the second was less than 5%. With this great challenge in the context of the government struggling to protect its population through vaccination, the Ministry of Health and partners re-evaluated the context, and the NITAG, the National Immunization Technical Advisory Group, found it crucial to evaluate available evidence and made some recommendation. They encouraged the Ministry of Health to strengthen communication and to move on to gender-neutral vaccination. Vaccinating boys and girls will downplay on the myth around vaccinating just girls. And also, they call on the government to move on to periodic intensification of routine immunization and to strengthen advocacy with local authorities, including the Catholic Mission and other religious bodies. So the Ministry of Health took on to this request and actually engaged in single-dose nationwide vaccination of girls and boys from January 2023. And this had some great outcomes. So we realized here that from 2023, girls' coverage actually tripled from just around 20 to over 60%. And since then, the coverages have been improving or the trend has remained upward. Notwithstanding, the program has faced some challenges, especially stock out from 2024 to 2025. We realize at subnational level, some regions will record up to 180 days of stock out of HPV vaccine. In the country, we further look at the impact of engaging in vaccinating boys alongside girls through this research that was published in the BMC Public Health last year. And we realized that nationwide, 30 to 40% of the country's regions experience an improvement significantly in girls' vaccination coverage, thanks to including boys in the vaccination agenda in Cameroon. Of course, the hindrances continue, as you see in this graph. Globally, from the onset, the country had a lot of HPV vaccine doses which they were unable to use, as you see in the dark blue indicating doses administered. But from the introduction of the gender-neutral vaccination, you see that the doses that were administered were almost doubled what was received that year. And thanks to doses from previous year, the program had been able to survive to vaccinate its target, especially girls, alongside the boys. And by 2025, you realize that, of course, this gap of vaccine stock out were partly managed by the country benefiting from over 100,000 doses from donation from manufacturer. So vaccine stock out in a context where the country has been experiencing improvement, partly linked to lack of doses for vaccinating boys, especially since Gavi, despite the excellent job they have been doing to improve HPV vaccination, they don't yet prioritize vaccinating boys. And so the government has to struggle to secure doses and sustain funding for this activity. Why should we vaccinate boys? Of course, it ensures herd immunity. There will be fewer infections circulating, and indirectly, the girl population, the women population will be protected, even for those who fail to get vaccinated. And directly, it will protect the male population. Noting that HPV-driven cancers affect men, and nearly 100,000 males are affected by cancers linked to HPV, like was observed in 2022. Even the stigma, like Kelly talked about earlier, vaccinating boys will help us refrain from HPV as it become an everyone's concern and help counter vaccine misinformation. And of course, it helps us to ensure gender equity, shared responsibility, build broader community trust as we put everyone on board. So in summary, gender-neutral vaccination, vaccinating girls and boys is really critical to controlling these HPV-driven diseases. As we can see in Cameroon, we face great challenges in improving girls' HPV vaccination coverage. But the moment we enrolled boys in the program, it enhanced girls' vaccination coverage. And HPV elimination and disease control, we know, must require strong engagement from all actors, including males and females, is critical to equity and disease prevention. Thank you so much for listening.
Thank you, Andreas. Less stigma, herd immunity, gender equity, and direct protection is a pretty compelling argument. Our next speaker, ladies and gentlemen, is Dr. Ricardo Berdier from the HPV Prevention and Control Board. Good afternoon, Ricardo. Over to you.
Perfect. Do you see my screen? Perfect. Okay.
Yes.
So thank you very much for giving me the opportunity to present today some of the preliminary findings that we've had on our project, who is looking at the early impact of implementation of gender neutral or universal HPV vaccination coverage. Do you see my screen still?
Yeah.
Okay. Perfect. So just as a disclosure, this study is funded by Educational Merck Policy Grant, unrestricted grant. So the overall goal of the study is to explore the implementation and early outcomes of gender-neutral vaccination policies in countries who have recently introduced. So there are two parts of this study. The first part, which is what I will present today, is going to look at the survey results from healthcare workers who deliver HPV vaccination. And then the second part that we're currently working on will be key informant interviews to further understand some of the data that we have collected. So we have shortlisted 5 countries. Those are the United Arab Emirates, Cameroon, Romania, Peru, and Argentina, which are countries who have introduced this policy. And then for the methodology, we have included 100 healthcare workers from each of these countries. And they were screened out if they were not involved with HPV vaccine counseling, prescribing, or administering. The survey was administered in their local language, and this data collection took place in September to October 2025. So, digging a little bit on the results, the first thing that we wanted to understand was what was the awareness of HPV vaccination program within these healthcare professionals. Looking first, we wanted to understand if they were familiar with the program, and then we see it amongst all of the countries, most of them had above 90% awareness of the program itself, with Cameroon having 73%. And then we wanted to look about the correct target age. And then here we can see that Argentina had above 90% awareness of the correct target cohorts, while Peru, Cameroon, Romania, and UAE had a weak awareness of this part. Then we wanted to ask about gender. So if they were aware of which genders were covered in their current vaccination policy. And then we've seen Argentina, Peru, Romania, and UAE have a relatively strong awareness of the genders, and Cameroon reported a 56%. Then we wanted to understand how confident they were, not only related to HPV vaccination, but in vaccination in general. So we define vaccine confident if the healthcare professional agreed that the vaccine is important, safe, and effective. So in vaccines in general, we see an overall high vaccine confidence among healthcare workers. And then as well, we can see it for HPV vaccination. Then we wanted to understand if these healthcare professionals will vaccinate their daughters with HPV vaccination, and we see all the countries are the healthcare workers from the country surveyed responded above 90%. And then when we ask about if they would vaccinate their own son, most of them agreed, with 72% of healthcare workers in Cameroon reporting that they wouldn't. Now, looking at the barriers of HPV vaccination, we basically, through the healthcare workers, we asked how frequent and why they were experiencing vaccine refusal and from who. So what we can see overall amongst all of the countries is that most of the vaccine refusal is being experienced from boys or parents of boys. It's more likely to experience refusal than the girls. And when we look at what are the specific reasons for refusal, we see for boys, it's an overarching topic about vaccine not being necessary and unaware of the benefits of the vaccine for boys. Meanwhile, for the girls, we see also unawareness of the benefits, but also some safety concerns, which is something that we've been seeing through all HPV vaccination implementation in girls as well. Then we wanted to really look into, since the implementation of the universal program, how have this affected the uptake in the girls? So when you see countries like the UAE, they report that since the inclusion of void, 67% report that they have seen a decrease in refusal from the girls' vaccination. We see similar patterns in Peru, and then also Romania, Cameroon, and Argentina somehow decreased since the introduction of male, which is really, really important and motivating. I think one of the last things that we wanted to see is how informed these healthcare professionals felt of the program. And although the majority of them reported they had sufficient information about their HPV vaccination program, 100% of them reported that they would want to have more training or materials or campaigns that could inform them about the program. We had an outlier, which was Cameroon, which 48% of the healthcare workers felt that there was sufficient info on vaccine risk, so that's less than half. And then 18% don't feel that there is, they don't feel confident enough to recommend the vaccine. When we further looked at what were the resources that were requested by these healthcare workers, they requested more training, guidance on vaccine hesitancy, guidance on discussing HPV-related topics, and clearer communication. So, in conclusion, we can see that most healthcare workers were familiar with the national HPV vaccination program, including its extension to boys. Vaccine confidence was high across all settings, which is really good, also for HPV. The perceived HPV vaccine refusal was higher for boys than girls across most settings, reflecting these asymmetric barriers, which actually call for a specific tailored interventions to also increase the awareness in boys. Despite high confidence, healthcare workers face communication challenges in both sexes, so says the benefit of vaccination in boys is poorly understood as well as the safety for girls. And then healthcare workers identified a need for additional support when these new policies are introduced. And then thank you very much. Just to mention that a second part of this study is currently being conducted where we're conducting key informant interviews with different stakeholders from this country to further understand and deepen how we can interpret these results. And thank you very much.
Thank you, Ricardo. And I'm right in saying, is it IPVS, that second paper, you're hoping to have that? Brilliant.
Yes, we will have a session in IPVS, an oral presentation where we will already really cross-check everything that all data we've collected with the surveys together with the key informant interviews to further understand this phenomenon.
Fantastic. Well, I'm not on commission from IPVS, but if you are thinking of a reason to attend, I'd say that this would be one of them alone. So thank you, Ricardo. Really appreciate that. And please do keep your questions coming in. I've got a couple for you, Ricardo, as part of that. I hope our guests do too. It's now my pleasure to head across the Atlantic to Canada, to Dr. Sandra Chidoriotis. Sandra, over to you for your presentation. We can see that now. Perfect.
Okay, my sound was okay. Well, good afternoon or good morning. My name is Sandra Kidariotis, and I'm joining from Ottawa, Canada, where I work for the Public Health Agency of Canada on vaccine confidence. However, today I am going to present a study I conducted in France a few years ago while working for the Institut Pasteur under the direction of Professor Judith Müller. Okay. So a little bit about me. I'm passionate about analyzing health behaviors and attitudes to support efficient public health programs. I've worked in cancer prevention and vaccine promotion, including on HPV, and I have no conflict of interest to declare. So a little bit about this research. It was a secondary analysis of a survey funded by the INCa, French National Institute of Cancer, and we did not receive any specific funding for this secondary analysis. So the research question we had in mind was, what is the impact of HPV gender-neutral programs on parental intentions to vaccinate their daughters? So many high-income countries have implemented a gender-neutral HPV vaccination program. And the objectives of such programs are to directly protect men against HPV-related cancers, to reduce transmission of HPV towards women, accelerating the elimination of HPV-induced cancers, including cervical cancer, and to support higher uptake among girls. The hypothesis behind this last one is that a gender-neutral program could enhance parental and care providers' perception and facilitate vaccine promotion efforts. However, at the time of this study, we didn't have data to support this claim. So we used data from a survey conducted in 2019 by the French National Cancer Institute on HPV vaccine acceptance among parents of children aged 11 to 19 years old living in France. So this was before the introduction of a gender-neutral program in France in 2021. And France had first recommended the HPV vaccine to girls in 2007. So a little bit more about the data. It was collected in June, July 2019 using a web panel. And in the final sample that we used for this analysis presented today, we included 1,424 parents from mainland France with at least one daughter, aged 11 to 19. Parents answer the questionnaire, one questionnaire per child for per daughters. So we ended up with questionnaires for 1,726 girls. Parents were asked about their socio-demographic status, their knowledge, attitudes, beliefs towards vaccination, HPV and the HPV vaccine. And they had questions around their daughter's HPV vaccine status. So we were able to conduct a pre-post comparison of parental HPV vaccine intentions before and after parents received an HPV vaccine information within the survey, which included vaccine information, specifically with men information, so that genital warts and cancers are caused by HPV in both women and men, and that some countries offer HPV vaccines to all adolescents, boys and girls. So parents were first asked, is your daughter vaccinated against HPV? And we found that for 34% of those girls, parents said yes. For the other girls, so for their parents, the girls that were not vaccinated or had an unknown status, parents were asked, if today someone was proposing to vaccinate your daughter, would you accept? And 30%, for 30% of those girls, parents said yes. Then the parents saw that HPV vaccine information brief, and they were asked again, if HPV vaccination were recommended in France for boys as well as girls, would you intend to have your daughter vaccinated? And we saw that for 17% of those girls, parents changed their mind. So how to explain this change of mind? Our first hypothesis was that this change of mind was due to improved general knowledge awareness through that HPV vaccine information brief. But when we looked a little bit closer at the data, we saw that this change was not associated with lower initial knowledge about HPV diseases and vaccination. It was associated with the male gender of the parent after controlling for knowledge. So this information seems to be particularly relevant to fathers. Our second hypothesis was that there might be a specific effect of the male information in the brief. So maybe there is a higher value assigned to a gender-neutral program. Maybe through the recommendation seems more convincing when the vaccine is given to both girls and boys, or HPV may be deemed more serious. Another hypothesis could be that this gender-neutral policy can remove the emphasis on young women's sexuality. So in conclusion, some parents may intend to vaccinate their daughters after receiving information on HPV and men, including information that gender-neutral programs exist in other countries. This could be used as a lever for HPV vaccine promotion, even in countries without a gender-neutral program. That could be done through healthcare providers' consultations or in informational campaigns. So the limitations of our studies, we didn't have a control group and it was on vaccine intentions only. But so I'm very pleased to see that the other panelists today have done more to assess the impact of gender-neutral program on parental attitudes, knowledge, and vaccine uptake of girls, because this is the kind of studies we need. And thank you very much. And you can find more information on the paper presented here.
Brilliant. Thank you so much, Sandra. And if I can invite all our speakers to come back on screen now, because we have a good chunk of time for a Q&A. So I can see Sue, Ricardo, Sandra, and Andreas, if you can join us. Ladies and gentlemen, please do add any questions to via the Q&A function. I have one to kick off, but first and foremost, thank you so much for those enlightening presentations. My first question for the panel generally is, why do you think that vaccinating boys improved uptake in girls? We can see that it helps, but why does it help? Yeah, Sue, please.
Yeah, I think what we saw in the ADVAC trial was that it was more about talking to people about the whole spectrum of infections and diseases associated with HPV. So expanding the conversation beyond cervical cancer alone. Yeah, genital warts seem to be a bit of a motivator in both males and females as well as Sandra had mentioned and others. So I think yeah, that's part of the discussion.
And that's open to anyone else, if anyone else had some thoughts they wanted to add on that one. Andreas.
Yes, thank you so much, David. Yes, so actually, from Cameroon's context, we realized the first thing was that vaccinating boys destigmatized HPV vaccination. Many people feared that there was something about wanting to vaccinate just girls. Firstly, sterilizing them. That was a major issue. And also, religious authorities also feared that if these girls feel that they have been protected from disease, then they will get into early sexual activity, and that was a major issue. And so the fact that boys were rolling downplay on this, and people realize, oh no, it's not just a girls' issue, it's something for boys and girls. So we are protecting all of them. And in that light, it also helps to limit disease spread directly for boys who are also directly affected by HPV and HPV diseases, including cancers, and also it limits boys spreading the virus to girls who are not vaccinated.
Thanks, Andreas. Ricardo, please come in.
Wanted to thank you, Andreas, for providing this context because you are on the field, and I just wanted to mention that um, if we really look at all the other antigens who are available, and we look at the history, what we have learned from for other vaccination programs, all of these misconceptions and all of these reasons for refusal of vaccine, if you really look at them, they are really linked. They are gendered. So they are focused because it's only given to girls. So when we look back, hepatitis B vaccination, how it started from it being only for high risk population and to being universal, I think that overall we will get closer to our goal if we make this universal, not only for the whole perception of the target population, but also because there is a lot of HPV related cancer that we will be preventing if we also vaccinate boys. So it also makes the whole program more comprehensive.
Sandra, please come in.
I think a reason is that it makes decision making for parents just easier. Like there's less, yeah, just that.
Yeah, just that simplifying that messaging is I think is all four of you in a way. That's the theme that's drawing through. Andreas, if I can turn to you, because one of the points that you made around Cameroon specifically, is it difficult to make the case politically for these resources to be used to vaccinate boys, given the lack of prioritization for male vaccination by global actors? You touched on that briefly. Could you share a little bit about how you handle this? Because clearly there's some sensitivities, but as you've shown, it's a really important. You've shown why Cameroon have made these steps to vaccinate boys, but clearly there's a bit of conflict, as it were, between different viewpoints on this issue.
Yeah, thank you so much for that. Of course, Cameroon is playing with it to try to navigate the challenges to get vaccines for boys. I must highlight that it's not been easy because there are times when we barely have something to vaccinate the boys. And given that it's not prioritized, but what the government has done at its end is to ensure that it purchases HPV vaccines directly for boys to benefit. Since we can't get it through the routine channel of Gavi, that of course ensures that girls are vaccinated to limit cervical cancer and other related HPV diseases in women. So this has been successful, but an additional challenge to it, like we observed in late 2024 and 2025, is that though the government was ready to buy, at some point it was difficult to even obtain the vaccines from available sources. There were stockouts also at other levels which the government could not address and get vaccines from the international levels. So we were fortunate through other manufacturers' donation to receive some vaccines in late 2025. And this helped the country to continue its HPV vaccination program because unfortunately, vaccine doses that are obtained through Gavi for girls cannot be used to vaccinate the boys, although it's the same vaccine, because the vaccines are tailored just limited stock for the girls' population. So the government continues to negotiate to get these vaccines available for boys. So it is already part of Cameroon's Ministry of Health agenda to get vaccines for boys using every resources and collaboration possible.
Thanks, Andreas. One of the, one thought, or one of the thoughts, as it were, is that by adding boys, it means that girls could then be deprioritized from the vaccination program. Is that a rumor or any truth that behind that as a comment? And I don't know if anyone here can sort of add something to how do you prevent that from happening?
Yes, of course, in Cameroon, the doses that are secured for girls are meant for girls. And so we ensure that that quantity of doses are available for the girls' population. And the communication around it is vaccinating girls and boys. And we make sure through every channel and key voices that the population has that in mind. Unfortunately, we are aware that if for any reason we don't vaccinate boys, then our story will be confused and people may not take HPV vaccine for their girl children may not be vaccinated anymore. And so we continue prioritizing girls fully, give all the attention that is needed, and continue to partner fully with Gavi to ensure on all aspects that these doses are made available for girls, while the government takes care of ensuring that there are additional doses for the boys' population alongside girls.
Ricardo, please.
I also wanted to this is something that we're asking ourselves as we are analyzing the data that we've collected. And I don't know if you saw Argentina, Peru, Romania, and UAE, when we asked their healthcare workers, like, how are they really feeling the first implementation effects of this? They are somehow more aware of the targets populations. They are more aware of the program, and they see less refusal from girls since the program was introduced. So what I wanted to mention with this is not only procuring the vaccines. That is, of course, a very important part, but there is a part of health system strengthening that it's really important. For example, Argentina and Peru, they procure through PAHO regional revolving funds. Romania and UAE are self-procured. So I have the feeling that these countries, apart from having the vaccine, they also really spend quite some funds on the implementation of these policies beyond only a policy, but also accompanying with training and education, which also makes a really important difference.
I mean, Ricardo, I think actually just sort of to zoom in on your presentation for a moment. I mean, more broadly, we know that there is poor awareness around the connection between HPV and disease in males. And yeah, as your presentation showed, these themes came up time again. Well, boys are not at risk. People are unsure of the benefit of vaccinating males. The vaccine is not necessary. Does this speak to, it's something that's being discussed at the moment. Should the next global HPV prevention strategy focus on all HPV cancer and disease? Because clearly we know that protecting everyone is important, and the role that males play in transmission, and the importance of protecting them themselves. And this is for the panel more broadly. Do we think by a broader strategy taking aim at all HPV cancers and diseases will go some way in actually to helping us quell some of that disinformation, because these are themes which, you know, I've certainly encountered in the 14 years that I've been in the space, is that we're still talking about, you know, this theme comes up that, you know, experts, you know, only 20 to 30% are aware that HPV causes cancer in males, and that could be from a paper I read in 2013 or one that I read in 2026. So yeah, I'd be interested to hear the panel's thoughts. Would a renewed strategy on all HPV cancer and diseases help to take aim at that?
Yeah, I would definitely agree that there would be a lot of opportunities if a global movement towards HPV elimination overall would be beneficial. But I think at the same time, putting myself from a policy perspective, like cervical cancer is the fourth common cause of mortality and morbidity in women. So I definitely do think that we need to prioritize and bring the vaccines where they can have the greater impact. But I do think that based on all the effort that has been done for cervical cancer elimination, there is an opportunity to build on about what evidence is showing and how important this tool we have is in preventing not only the cervical cancer, but all HPV-related cancer. So I think they can go one in hand.
Sandra, please.
Yeah, HPV doesn't just cause cervical cancers in women, but also others. And we see that like countries like Australia or like France more recently, they really use that messaging of a HPV preventing cancers and like listing all of the cancer that they cause, and not just saying cervical cancer. And we see now that in countries where there's a gender neutral program, I'm going to speak about Canada, we see that the HPV burden of disease might be higher in men than women now, like in countries that have had a long HPV vaccination programs with females being protected, and then basically the cancers rates in men, like for head and neck cancers, are starting to like shift and be more prevalent in men. So how do we explain that there's been a lack of men have had a lack of chance, like not getting that protection earlier in their lives. So we're going to have to answer questions like that in the future. So, and we see some of that data coming, and I think we should communicate more about that in countries where, like Canada, where we start to see that difference in trend.
Sandra, there's actually a question for you here. Do you have any, building on your previous paper, do you have any plans to conduct similar research with more recent data? The comment was, perception towards the vaccine might be different now. I don't know if we had Sue's continuing work, Ricardo's paper. I know Andreas is always working on HPV, but will you be re-entering the field on HPV anytime soon?
Yeah, so I saw that question. For France, I'm going to speak about France now. So this question in the chat, perception towards vaccine might be different now compared to before COVID. So actually in France, so the gender neutral program was introduced in January 2021, so during the pandemic. But then also in 2023, they implemented a school vaccination program for HPV, so for boys and girls. And so we have data now on vaccine coverage in France for like the most recent is 2025. And we see that a steady increase in HPV vaccine coverage among girls during the pandemic and so it doesn't seem like in France the COVID-19 pandemic impacted the perceptions of the HPV vaccine. It seems like and I was just a witness from Canada at this point, but it seems like the vaccine hesitancy was focused on COVID-19 vaccine and did not really impacted the other vaccine perception. So that's really positive. And now we've reached I think 62% vaccine coverage in girls. When France was very struggling at the time of the study in 2019, we only had 30% vaccine coverage in girls at the time. So very nice increase.
Yeah, very, very significant. Well, ladies and gentlemen, I'm aware of time. If I could ask my dear panelists if they could answer any questions we have outstanding in the Q&A that they feel are relevant to them in the meantime. But please do, if you want to email us with questions as well, please do. I will now hand over to Tim Shand for some final steps. Tim, over to you.
Great. Thanks so much. Can you see the slides just very quickly?
Yes.
Great. Thanks so much, everyone. Just a very final summary of some forthcoming activities. This conversation does not end here. We're really thrilled with the level of participation and the importance which everyone is giving to this conversation. And we'd love you to continue in collaborating with us, engaging with us, and journeying with us as we continue to highlight the importance of looking at all HPV-associated diseases, as mentioned, and within that, critically vaccinating boys as well as girls. We have a couple of forthcoming activities that we really want to highlight. Please do sign up to our newsletter if you haven't already. I've put the link in the chat. Please endorse our global call to action on this very topic if your organization has not already. I've shared this with a couple of people today. We are keen to increase the number of endorsements because it helps us to advance this issue and engage at a higher level within the international community, within governments and with donors. We will be coming out with a position statement in the academic literature reflecting this conversation and the importance of routine universal vaccination, so stay tuned for that. We'll be at a number of conferences this year, the World Congress on Public Health, the World Cancer Congress, and the annual IPVS conference, so please do join us, say hi. If you're there, we'd love to engage with you and continue this discussion. We advocate globally and in collaboration with our partners in countries around the world for boys vaccination. And if you would like to do more in your country to advocate towards your government, we have letters that we can share with you for you to share. We can help you to lobby and engage with the World Health Organization, Gavi and others. So please do reach out to us. We'd love to hear from you. We have an advisory group of men who have lived experience of HPV-associated cancers. If you or someone you know would like to be part of that, please do get in touch with us. We're always keen to expand that advisory group and to learn from their opinion and ensure it infuses and informs our work. Stay tuned for our next webinar. We're thrilled that on the 17th of September at 2 p.m. UK time, we'll have a specific conversation about penile cancer. We've already got 2 confirmed speakers for that conversation. One, Dr. Ben Ayers from the European Association of Urology, and Patrick Howard, a penile cancer survivor. So mark your diaries if you haven't already. Thursday, 17th September, 2 p.m. Sign up to our newsletter to hear more. Thank you to all the organisations that make this work possible by endorsing us, by supporting us, by engaging and continuing this critically important discussion now and through 2030 and beyond. Please do evaluate these webinars. All your feedback is extremely helpful as we think about future topics. We do read every single evaluation. I've put the link in the chat. We will share with it after. And as I say, thank you again for joining us. If you haven't already endorsed us, please do, and look out for our report on men, boys, and HPV. It's a great read if you haven't, and we'll shortly be circulating a revised version too. So thank you for this wonderful webinar today. Back to you, David.
Thanks so much, Tim. Well, it's just gone the hour. I know how busy everyone is, but my sincerest gratitude and thanks to our wonderful speakers, Sandra, Andreas, Ricardo, and Sue. Thanks so much for joining us, and have a lovely rest of the day wherever you are. Thank you. Goodbye.
Thank you. Bye-bye.
Thank you. Bye-bye.
Goodbye. Thank you.